The anatomy of the heart. Heart is a pump which is operated by many electrical and mechanical components. The right side of the heart circulates blood to the lungs, where deoxygenated blood becomes oxygenated, and the left side of the heart circulates it to the rest of the body. The atria. There are four chambers of the heart, two atria, two ventricles. The atria are thin walled structures that acts as pump for these ventricles. This right atria, this right atria or right atrium receives blood from superior and inferior vena cava and coronary sinus. The left atrium receives blood from pulmonary veins. The right ventricle or the ventricles are thick walled structures as they need to circulate blood under pressure. The atria and ventricles are separated by valves, atrioventricular valves. The right ventricle is about 2 to 3 millimeter thick and triangular in shape. The left ventricle is more conical in shape. The left ventricle myocardium is around 10 mm thick because it has to pump blood at a higher pressure than right ventricle. Now the coronary circulation. The left main and right coronary arteries, they are arised from left and right sinuses of aortic root. This is left coronary artery and this is right coronary artery and this is aorta. First arteries from the aorta are left and right coronary arteries. Now within 2.5 centimeter of these arteries or left coronary artery, the left main coronary artery divides into LAD and CX. LAD means left anterior descending artery and circumflex artery. Now this LAD gives branches to supply anterior part of the heart, even lateral and apical walls of left ventricle. The CX, that is circumflex artery, this which is shown in faint line, gives marginal branches that supply lateral, posterior and inferior segments of left ventricle. Left side artery, that is left main coronary artery, gives circulation to left side of the heart by LAD and CX, that is left anterior descending artery and circumflex artery. Now the right coronary artery, right coronary artery gives branches which supply right atrium, right ventricle and some inferior part of left ventricle. This right coronary artery supplies SA node, AV node and some part remaining part of right side of the heart. As this right coronary artery gives circulation, blood circulation to SA and AV node, if there is sinus bradycardia or any occlusion in this artery, the result is in sinus bradycardia or AV nodal block. If there is problem in AV or SA node, definitely there is occlusion in right coronary artery. If there is occlusion in left coronary artery, then suspected MI or angina is there. Now, the venous drainage of these coronary arteries. These coronary arteries eventually drains into coronary sinus, which is in atrioventricular groove, and then they drain into right atrium, by which the deoxygenated blood is drained for oxygenation. The lymphatic system drains into vessels that travel with the coronary vessels, which then eventually drain into thoracic duct. Now the conduction system of the heart. The SA node. The SA node is situated at the junction of the superior vena cava and right atrium. This SA node, AV node, right and left branches till the Purkinje fibers. These include the conduction system of the heart. This SA node has a special atrial cells that depolarize at an rate influenced by autonomic nervous system, which is controlled by catecholamines. Now the nerve supply of the heart. The heart is or has both sympathetic and parasympathetic fibers. The myocardial contraction is by myocardial cells which are 50 to 100 micron meter long. This is myocyte, and in between there is intercalated disc. This intercalated disc permits electrical conduction via gap junction and thus gives signals to the adjacent cells. There are two cardiac peptides, ANP and BNP. Atrial natriuretic peptide and BNP is brain natriuretic peptide. This ANP is a vasodilator and BNP is a vasoconstrictor. Now, how this circulation happens? The right atrium receives deoxygenated blood from superior and inferior vena cava, and this right atrial blood is discharged or it is pumped in right ventricle, which then goes to pulmonary artery. Blood from pulmonary artery and alveolar capillary bed is oxygenated. This oxygenated blood drains through pulmonary veins into right atrium. Again, this oxygenated blood from right atrium passes to left ventricle, which from left ventricle it is passed to aorta, then to the rest of the body. Deoxygenated blood from superior and inferior vena cava to the right atrium, then right ventricle, pulmonary arteries, then to lungs. From lungs, pulmonary veins to left atrium, left ventricle, aorta, and to the rest of the body.